Sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Psychological. We spoke about stress last time. Good morning, everybody.
Good morning. Here's
Good
Dr.
morning.
Mencia, and I'm Anita
Beautiful
Finley.
weather today.
Nice
and
looking
cool.
out.
It's sunny. No more rain and all this thing.
And so people are going to stay inside, and
Some
they're going to
people
want to
might-
make love. And now what?
Well, that's it. Can you perform? Can you perform?
Is it a performance, really?
Last time we spoke about stress, and both in men and women, stress can be an important factor in a person being able to perform. Those people with ED or erectile dysfunction, also known as impotency. And one of the major problems is the social myth behind it, that we feel that we are less of a man or less of a woman if a woman has what we call female sexual dysfunction. That's the ED portion of the woman, female sexual dysfunction of FSD. And what people need to understand from this show today, for our Pencil Talk audience, is that many times erectile dysfunction, although it can be a psychological component to it, it also can be the first manifestation of an other condition in your body. And I had a conversation with my urologist, Dr. Gupta, and Dr. Gonzalez, my interventional vascular doctor, surgeon. And I told him, we need to do an ED clinic. And the main reason, just like before we went on the air, we were talking about all the pills that are out there that we call those quick fixer. Oh, she's going to take a picture again.
No, just keep talking. Don't let this...
Those quick fixer. And with a quick fixer, like Viagra and Levitra and all of those pills there, it's not really solving the problem of your underlying condition. It will produce an erection, whether you are with a woman or no. Viagra had been studied in women with some result not very compelling, but it had been studied in women. And they are not benign medication. These are medications with significant side effects that you should consult either with the beauty with the ED clinic that we have at the center is that you're going to have the geriatrician or internist or family practitioner. You're going to have the urologist, and you're going to have the interventional vascular physician, so that we can go ahead and try to find out if it is a mechanical problem. Let's solve the problem so that you can have normal erections moving forward. Now, in the counterpart, in the female, if there is a vascular problem or not, guess what? It had not even been studied. That had not even been looked at. So those are the type of questions that we want to investigate at our center, at the Adult and Geriatric Health Institute, to find out, we know in the men, it's a lot of the men, it's a vascular issue that can easily be fixed. It's not major surgery. So sometimes we just go there, just like we do for the heart. When a person needs better flow, we do the same thing for the male organ, so that they improve their flow. And if they get aroused with their partner, guess what? They'll get an erection.
Okay. Well, there's so many little ifs and buts in this, pardon the expression, in this whole thing. But I think what people are always afraid to tell their doctor, it's embarrassing.
Exactly.
So, I mean, how do you get them to tell you? Do you say to them, how's your sexual life, or what do you say to get people to open up to you, Dr. Mencia?
In the men, the first thing they need to understand what is erectile dysfunction. if you are with an ugly woman that you never
You're
been
so
with
bad.
before, and you are very attached, to your wife, and this ugly woman has a bad vocabulary, and everything she does is completely against your moral value, and you say, you know what, you will never get an erectile dysfunction even if she walk naked in front of you. So, but the definition of erectile dysfunction is in whether homosexual or heterosexual. The definition is when a man cannot get or hold an erection firm enough for sexual intercourse. Now, a person can get an erection, get aroused, get an erection, but cannot penetrate. So that is that is by definition ED, if he cannot penetrate his partner. So they have to be able to have sexual, perform and have sexual intercourse.
But wait, I have to keep interrupting. I'm the woman in this deal,
Absolutely.
so I'm going to keep penetrating this whole subject, right? Okay, so the subject is this, and you were right. It's one thing for someone to get excited,
Exactly.
but then
aroused.
to fulfill that.
To
Now,
fulfill,
a lot of it
exactly.
also depends on the woman. Even though the man,
It's
yes,
a partner.
Yeah, it's a
It's a
partner.
partner thing,
So-
right.
Exactly,
It's a
because
partner
we
thing,
know. We know that women, it's been a big joke about having headaches or they're not ready. Well, that's going to turn a man off unless he's very young and he has lots of testosterone. But I think an older man needs to dance a little bit, kiss a little bit. There's a lot of other stuff
the
going
question
on.
is, what arouses you? What is your sexual desire? What will arouse you? And the partner not to be judgmental. If what arouses you is being touched on the breast, being kissed by the ear, being kissed by the neck, what arouses the person is what's important. And if the partner, if they are not able to communicate with each other and ask each other, I mean, some people are afraid to ask, and they just start doing things to see where hit and miss.
Yeah.
No, just ask your partner, what do you like? What arouses you? What makes you excited? And then you perform according to your partner, and vice versa. A man sometimes is afraid to tell the woman what makes him excited, what arouses him. Now, for my, as a geriatrician, my elderly patients say, if I'm 98, do I have to have sex because I'm 98? Not necessarily. As we age, holding hand is, just bring satisfaction in our life, make us happy. So just holding hand, hugging each other, watching a movie, those sort of things. Just holding the pinky on each other. That's
Or sleeping, spoon, or doing something. But I want to
Exactly.
get into some other things that, and you were very always blunt on our show because this is a very important show.
It's real
but
life. This is reality.
It is real life, and it will help people to feel better. And I think we once discussed this. It's important, though, that we understand this is very physical. This is very healthy. See, a lot of people think it's just a sexual fun thing, but when you think about people,
It
if
is
they
fun.
don't have orgasms,
It is fun.
And it is fun. Of course, it is. But the ultimate is having an orgasm. And
so
if
much
you
fun.
can't have the orgasm with someone, you can do it yourself. And last week I
Of
had
course, yeah.
I had a gynecologist obstetrician call in from Boston, it doesn't matter, New York. And she teaches, she's a professor at one of the universities, and she's a working gynecologist obstetrician. And she has a fantastic book called Love, Sex. And we did a lot of discussion, and she really talked about that women, especially older women, they think it's wrong, that they shouldn't do it. And having orgasms for women, men know how to do it. They've been having it a long time.
Right.
It's the woman who somehow the mother said, don't touch yourself, don't do this.
Exactly. And you grow up with this myth
All right,
in your...
so how do you as a doctor help that woman?
Well, it depends, because in a woman, when they have that persistent, recurrent problem with sexual response or desire, it can be divided into 4 types in a woman. In a woman, it could be a low sexual desire, what we call decreased libido, or the lack of sexual drive in a woman. Okay, and that can be induced by stress and many other things. Then you have the sexual arousal disorder. And what this category entails is having difficulty or being unable to become aroused. It could be a partner problem. It could be that the partner is touching you on the wrong area and you are afraid to say something, or you are faking it, but you are actually not getting aroused. And the third one is the orgasm disorder. And on this one, the person, your partner, is able to touch on the right place, but you have this persistent or recurrent difficulty in achieving orgasm despite having sufficient sexual stimulation. So the partner is doing everything right, but you are unable, and those are the person that need to see the doctor and say, do I have a heart condition? And the fourth one, before I go into the causes of dysfunction in men and women, is sexual pain disorder. Sexual pain disorder is two types. One, it could be that the vagina is too dry, and the penetration can be very painful because the nerves are more exposed because of the dryness and the thinning of the vagina, and that's usually a hormonal problem. And the other one is what we call vaginism. Vaginism is that woman you were just mentioning that had been told throughout her life you should not be touched by a man, and when they are in the act of trying to perform with a partner, the vagina closes like a tight muscle, like a sphincter. And it's very difficult for the men even to penetrate.
Amazing.
And a lot of
I've never heard of this before.
It's called vaginism. And a lot of time, the woman say,
it's mental.
Only time, it is mental. And the woman will tell you, the only time I'm able to let go if I'm extremely drunk, which means now they are inhibited, or if they take an anxiolytic, or they take something to basically knock them out. But then how are you going to enjoy your sexual act?
This is amazing. I thought you were going to bring up the subject of not having the right hormones.
Stuff. Hormones is also very important, but
that's
hormones
be
is on the other part.
Okay.
But
this is all mental and psychological.
Disorder, absolutely.
And how are you, Dr. Mencia, going to handle this?
Well, a lot of times, that's why we need a team approach. That's why we need, my background before becoming an MD was a psychologist, so I have the psychological background. We have the urologist, Dr. Gupta, and Dr. Gonzalez, the vascular. So we approach it multidimensional. We have the dietitian if it's a problem with diabetes. But let's go through the causes. What can produce this dysfunction in both men and women? Keep in mind, the moment you feel that you're having erectile dysfunction or female sexual dysfunction, it could be the first manifestation of a heart condition, heart disease. Also, hardening of the artery. So if you have atherosclerotic disease, this will also prone you to ED or female sexual dysfunction. Increased cholesterol, increased blood pressure, diabetes, obesity. The metabolic, what people could know is known as the metabolic syndrome, the X syndrome. Now, in the metabolic syndrome is defined as a person with elevated blood pressure, elevated level of insulin level in the blood, increased cholesterol, and increased body fat around the waist. Now, for the obese listener, because you have increased body fat around the waist, that doesn't automatically mean that you have a metabolic syndrome or syndrome X. Why? Because a lot of my obese patients has normal cholesterol, and they don't have increased blood pressure or anything like that. Everything is under control. So that to meet the criteria of metabolic syndrome, you have to have all of the above. Okay, it's not like, I'm obese, I'm going to have a metabolic syndrome. If you are obese by itself, that can affect your sexual performance. Parkinson's disease, very important, is multiple sclerosis. More in women than men. It can affect their sexual performance and sexual drive. Low testosterone in both men and women. Sometimes we have to give the woman a very low dose, and that's what's important. You cannot take the dose of your partner testosterone to help you perform. You have to come to the center, or you have to go to your doctor that know how to do hormone replacement and give you a very low dose of testosterone to help you with this problem. And then many drugs out there that can affect sexual dysfunction. So a lot of time the answer is not to take Viagra or Levitra or one of those other drugs. A lot of time is to talk to your doctor to see, can you please look at my medication? Is there something there that is affecting my sexual performance? And there are many drugs, so the doctor should go through the list and say, let me change this one for that one and see if that will help you, and so on. If you are a smoker, of course, that can affect blood vessels, and affecting blood vessels is just having high cholesterol and high blood pressure and all of that. Alcoholism, a person that drink in excess, both male and female, will affect sexual performance. Now, the psychological causes, we spoke last time a lot about stress. Of course, stress has to do in the psychological etiology of erectile dysfunction and female sexual dysfunction, but also depression, anxiety. A person, when they are about to perform, they might become very anxious and will not allow them to give in and enjoy the moment. And relationship dysfunction. Okay, and it's all what excites you. Some people get excited after a big fight, and some people don't want to be touched after a small argument. So what is in your book of games?
Dr. Mencia, it makes me think of something. I don't know if I read it in books or I just know it. But there are a lot of couples who are very happy with one another, and mostly it's the man that can't perform because of various things. Yet he can go out and find a prostitute and do great.
Right, exactly.
Talk about that.
Exactly.
So what happens?
Well, with a prostitute, basically, it's a one night stand. So she doesn't have to know you. You don't have to know her. Okay, so you are
Takes
looking.
the pressure off of everything.
It's been
just an act.
To me, a man that need to see a prostitute is a person that downgrade women. It's a feminist. It's like women are there as a sexual object. So if my wife is sick, I just go and see a prostitute and perform with a prostitute. And take all the risk of all the sexually transmitted disease and all those things. Okay, so usually a man with good moral value, with strong moral value, will never go that route. But have the person that go to those clubs where the women are dancing naked, and they go there and they feel very excited to do that. But again, that's the woman lending themselves to be low, and the men feeling macho.
Well, I'm going to give you a little, did I tell you the story? So when a big club opened up in West Palm Beach, and I won't tell you the name, but it's a gentleman's club, we went because we were part of the press, and it was very exciting.
They should call it Macho Club.
The Macho Club. Well, it was a little different. But anyway, I remember the food was great, and the women they were topless, and I just thought it was very elegant inside, and so it was my birthday. And I told Bill, this is 30 years later. I said, Bill, I want to go to that club for my birthday because it was fun. Let's go, right? Mm-hmm. Anyway, he didn't really particularly want to go, but he went with me because I wanted to have that as my birthday present. So we went there. It was not what I remembered somehow. The ladies were not topless, but they got up on a bar. They got on the bar with the ring. And so we sat there and watched, and of course, Bill now has macular degeneration, so it's dark. You can't really see anything that's going on.
No wonder he didn't want to go.
Poor guy, but I was looking, I was enjoying what I was seeing and all. So then we sat there. The food was very good, so the dinner was fine. But we sat there. We didn't do anything else, and so we were going to be leaving, and a woman came up to us. This is very funny. A woman came up, one of the dancers, and said, "Are you enjoying yourselves?" And he said, "Yeah, that's fine." She said, "Is there something else we could do for you?" And I laughed. I said, "No, thank you." I figured what they were doing is that they probably have couples come there that want to do other things.
Yeah, exactly.
And so we left, and Bill said, "I said, I'm sorry I invited you. It was a lot of money. We shouldn't have done it." But I just, in my brain, I had seen something different. But it wasn't the same. Poor Bill, he suffered through this. It was too dark, and oh my goodness. So you see, that was just one of those things.
I have a friend of mine took me to one of those clubs.
Right.
And, the lady come by, beautiful lady come by, and, young girl, and she sit next to me.
Right.
I say, "You want company?" And I said, "Yeah, sit with us." And she's sitting. So she started going through the question. I said, "No, honey, listen. I'm here because my friend asked me to be here." She goes, "Oh, you are homosexual?" I said, "No." I say, "No, honey, I'm not, but just don't." I don't want anything to do.
Man, I don't.
I don't want anything to do with
Right.
people like.
Right,
I don't
right,
want to meet you in
right,
this place.
right,
Let's
right,
put it
right,
like that.
right, right,
That
right.
makes sense to
Right,
you.
right, right.
She goes, okay, I see where you're coming from. So, but in women women with sexual dysfunction, they could have a low estrogen level. They could have thinning of the vagina lining. And usually the thinning of the lining of the vagina can give you what we call dyspareunia, which is painful sexual intercourse. And then the dryness of the vagina, it becomes then a psychological component. It becomes a vicious cycle. One organic thing is affecting psychologically, which affects you socially, because you don't want to go and meet people. Because you say, if I meet somebody, eventually the subject of sex is going to... So you stop not trying to meet people. So it can affect, your sexual performance. The psychological and social issue is the untreated anxiety or depression, a long-term stress in a person's life, long-standing conflict with your partner, an issue with your body image. I had a patient that her problem was that the labia, you have two labia in the vagina, what we call the labio major, the major and the minor. So her labio major, and by the way, when we are in the embryonic stage, we both, the man and the woman, we both look alike.
Yes, as
We
an
both look
embryo.
alike. If you
That's
look
I've
at
heard that.
Yeah, the penis of a man look like the labia major of a woman.
Interesting.
And then it just fuse together and become a penis.
Wow.
And the
That's good news.
clitoris of the women become the gland of the penis. So the way God made the body is a lot of overlap between men and women. Okay. So her problem was that the big lip, the large lip, which called labia major, were too long. And she was, affected when she said every time the men will look at me, they're going to be affected by that. And I
So
said,
there's
well,
surgery for that, isn't there?
There's surgery for that. But I said, before you go for surgery, did you ever ask your partner, does this bother you? And if it does, there is surgery. It can be fixed. I'll send you, we'll get it fixed. And the partner say, no, as long as you put those things to the side, I can penetrate.
Because that's really, it's interesting. That's another subject.
It can be something very, very minimum. Also, for, if you have that problem, you want to make sure that if you have thyroid disease, that is well treated, that if you have depression or anxiety, if you need estrogen therapy, or if you need testosterone in a woman. Sometimes they need a low dose of testosterone. If you take nitroglycerin for angina, for chest pain, you take nitroglycerin, avoid taking medication like Viagra and those sort of things.
I know you want to get through all this, but I've got to tell everybody who you are and how to get you.
Yeah.
I'm Anita Finley, and I'm
I'm
enjoying,
Andy Mencia.
but I'm enjoying this show. I don't even want to be on it. I just want to listen. Dr. Ann,
We're going to keep
Dr.
going, man.
I'm
Part
enjoying
two.
this. But this is, you've told me a lot of things I really don't even know, which is unusual in this area. But the Adult and Geriatric Medical Center, Dr. Andy Mencia is the founder and the medical director, and his number to call him to make an appointment, and they are open on Saturdays. It's 954-489-1345. That's 954-489-1345. They're located at 1608 East Commercial Boulevard in Fort Lauderdale. It's a happy place. It's a place where you're really going to learn a lot, and people are going to love you and take care of you. They do home visits. It's very important for homebound patients, and as I said, they're open on Saturdays. And I know that you're really, this is a good subject for you, but let's just say to the people out there, okay, everyone, if you haven't had really enjoyable sexual relationships, with your, let's say with your spouse, let's just go there.
Both sexes.
Yeah, both sexes. And if you're now either divorced or you're a widow and you're a little nervous about all this, sit down with Dr. Mencia. That's one thing about him. He will give you the time, and he's very open about all this.
A lot of times patient can say, doctor, I need to talk to you in private. And it's okay. The staff will walk out of the room. It will be a one-on-one conversation.
Right.
And we can just spend a few minutes. Also, we do holistic medicine at the center. So from the holistic point of view, there is something called mindfulness. And mindfulness is when you meditate on being mindful, aware of yourself, aware of the present moment. It's what we call in Buddhism the here and now. So a lot of times, especially in men, and now the working women also, many working women out there that are in bed and they're still thinking about their job and they're meeting the next day. When you are at that intimate moment, enjoy the here and now and put everything aside. There's also acupuncture. If you go to an acupuncturist, that's really good. You can talk to that person and say, I'm having sexual dysfunction. And they can also treat you with acupuncture. And in yoga, there are many techniques that produce sexual arousal
in yoga.
In yoga. So there are
You're
many
full
things.
of information, aren't you, Dr. Mencia?
The beauty here is that we do
sleep
both.
at night?
I don't do that. Against my
No,
religion.
but the mindfulness must be very hard for you. Not hard. That's what saves your life, I think, because...
To me, it's very easy because being a grandmaster in Taekwondo, I'm always, working with meditation. I've been doing meditation since transcendental meditation came into this country. So working with the mind, when a person work and psychologically just work themselves into calmness and enjoying the moment and putting everything out of, they can enjoy a good sexual relationship, regardless of your age. One thing that is important is erectile dysfunction and sexual dysfunction in a woman is not when you hit 60. It could be in your late 30s. It could be in your 40s. Okay.
I think you've made that very clear. It depends what's really happening to you internally.
Exactly.
And yet we know that there are people in their 80s still having very good lovemaking. So thank you, Dr. Mencia. As usual,
Yoo-hoo!
you hit the spot, as they say.
Yeah.
You hit the spot.
I gotta go and practice now.
I'm not going to that G spot. I'm just saying you hit the spot.
The G spot.
We'll talk about this
My
another
favorite,
time.
yeah.
You're so bad. Enjoy yourself. Thank you for making our morning really joyful. And we're going to get into UFOs now. I wonder if they do it up there too. And they must.
And we are seeing patient today.
Wonderful. Okay, well, let's have a little break, and then we're going to go to our Book of the Month author who's sitting here, A.R. Roberts. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.